Dear viewers, I welcome you all. My name is Dr. Rameez Manzoor. I work as Assistant Professor in the Department of Social Work, University of Science and Technology, Meghalaya. Today, we will be discussing a very contemporary issue in our society. The topic that I have chosen for the discussion is disability. We will be discussing the concept of disability, the models of disability, and the demographic details of disability in India. If we see the conceptual framework of disability, World Health Organization has defined disability as an umbrella term covering impairments, participation restrictions, and activity limitations. If we see what are the impairments, impairments are any loss of or abnormality of psychological, physiological, or anatomical structure or function. We may say that any impairment is any loss of any body part or the functioning of that body part. If it hampers, so that is an impairment. For example, loss of leg, or there may be loss of vision, so that is part of impairment. Then if we see disability, disability is any restriction or lack resulting from an impairment of ability to perform an activity in a manner or within the range considered normal for an human being. So if we see disability is considered as the terms that are covering impairments, participation restrictions, and activity limitations. Participation restrictions are nothing. It is when a person with impairment is restricted to participate in any activity. It may be resulting from any discrimination. So when a person in a society is restricted to participate in a particular activity, so that is called as participation restriction. For example, restricting a particular person who is having impairment, restricting him from attending school, or restricting him from employment opportunities. So that is participation restrictions. Third concept is activity limitations. If we see activity limitations are inability to perform any activity. For example, a person may not be in a position to perform any activity. He may not be able to walk, or she may not be able to hold anything. So that can be activity limitations. If we see disability, that is no longer viewed as merely the result of impairments. However, if we see the different models of disability, we have the charity model, we have the social model, and we have the medical model. As per charity model, if we see, that is the most oldest model of disability. In society, if we see in ancient times, persons with disabilities used to consider that they are no longer abled. They are not able to do any activity. So people used to give them charities. They used to be dependent on other members of the society. So that is one of the oldest model that considers that persons with disabilities are not having any abilities to perform any activity. Second model is medical model. Medical model of disability considers disability purely as medical. So it considers that disability may result from some medical issues, and for solving such problems, we need to much more focus on medical treatment of that particular person. However, main model of disability is social model of disability. It talks about the barriers that society puts for the persons with disabilities. It talks about the barriers and facilitators. This model says that it is the society that creates obstacles or barriers for persons with disabilities to participate in different activities in the society. If we remove these barriers, so it will be easy for persons with disabilities to join mainstream. They can develop themselves by participating in different activities in the society. So that is why social model of disability more talks about inclusion. It more talks about facilitating persons with disabilities in the society. it more talks about the empowerment of persons with disabilities. Then if we see the overview of disability in India, as per the census of 2011, if we see the persons who have disabilities in India, so there are total 2.68 crore persons with disabilities in India. And if we see as per the gender wise, so males constitute more disabilities than females. Males have 1.5 crore males have disability, and 1.18 crore females have different types of disabilities in India as per census 2011. If we see the share of disabled persons in different states or union territories to the total disabled persons in the country, if we see the percentage of persons with disabilities in different states, so we can see that Jammu and Kashmir has 1.35 percentage of persons with disabilities as per census 2011. So with Uttar Pradesh having 15.5 percentage of persons with disabilities that constitute total disabled persons in the country. If we see the disabled population in India, so we can see here, we can compare rural urban areas in India. If we see rural areas among females or among males, so males have more disability than females in both rural areas as well as urban areas. So here in this slide we can understand that males have a disability, more percentage of gender wise if we say, so males, the percentage among those who have developed different types of disability are males than females. If we see the typology of disability in India, so we can see as per 2011 census we used to have 8 categories of disabilities as per Persons with Disabilities Act. Now we have a new act, that is Rights of Persons with Disabilities Act 2016. As per that act, there are 21 types of disabilities identified in India. But we have a data of 2011 census, and based on those 8 categories of disabilities, we have data with us. If we see 19% of people are those who have visual impairment, those who cannot see or those who have low vision. Then 19% are those who have hearing impairment in India. Then 7% of disabled persons are those who have speech impairment. 20% are those who have locomotor disability, those who cannot move from one place to another, or those who have difficulty in movement. Then 6% are those who have mental retardation. Now in this new act we no longer use the term mental retardation. However, we use the term intellectual disability. Then if we see 3% of disabled persons are having mental illnesses, and then we have 8% those who have developed multiple disabilities, those who have more than one type of disability at a time. So in this data we can see that larger percentage of persons with disabilities are those who have developed locomotor disabilities. Then if we see distribution by sex, it is the percentage in each type of disability in India. If we see gender wise, and on the other hand we have types of disabilities. So if we see here in this slide, in each type of disability we may see that males have more disability as compared to females. In seeing, if we see visual impairment, 52% males have disability while 48% females have disability in visual impairment. And if we see hearing impairment also, 47% are those who belong to female and 53% are those who are the males. Then in each category, if we see in speech impairment, if we see 44% are those who are females and 56% are those who are males. So in each typology of disability, we can see that there are more percentage of males who have developed different types of disabilities as compared to females. If we see the disabled population by age group in India as per census 2011, so we can see that 0 to 4 years 12.9 lakh people, 12.9 lakh children have developed different types of disabilities. And if we see the majority of the percentage, that is 10 to 19 years of persons with disabilities, they are in 46.2 lakhs are those who have developed different types of disabilities. And if we see the graph is declining, however, if we see the age group of 60 to 69 years, 26.6 lakhs are there, those who have developed different types of disabilities. If we talk about the global statistics about people with disabilities, so if we see 10% of the world's population lives with different types of disabilities. So that is we see that it is a huge percentage, that around 10% of the world's population live with different types of disabilities. Then 80% of people with disabilities live in developing countries. Poverty is related to disability. Poor people, those who live in poverty, it affects their health as well, it affects their education as well, it affects their livelihood as well. So that is why they cannot afford treatment in certain cases. That is why we see a majority of the people, those who have disability, they live in developing countries. And an estimated 15 to 20% of world's poorest people are disabled. As I told earlier that disability and poverty are related to each other. Poverty contributes to disability, and in the same way disability contributes to the poverty. There are no rehabilitation services available for persons with disabilities in 62 countries. So here we can see that there are no sufficient rehabilitation facilities available for persons with disabilities in various countries. Only 5 to 15% of people with disabilities can access assistive devices in developing countries. These assistive devices help these persons with disabilities to perform different types of activities. An example of assistive device can be a wheelchair, or it can be crutches. So if we see that a vast percentage of people with disabilities don't have access to different assistive devices. So if we talk about children with disabilities and their education, they are very less likely to attend schools because they face number of barriers in going to the school and attaining the education. People with disabilities, they also experience higher unemployment rates. If we see the percentage of unemployment among persons with disabilities, it is very high. If we see the status of school attendance of disabled population in India, so this category of children with disabilities is 5 to 19 years in India. If we see 61% children with disabilities are those who have attended educational institutions. However, 12% are those who have attended educational institutions earlier, but there are dropouts as well when it comes to children with disabilities. They may not find suitable environment within the school system, or they may face attitudinal barriers. That is why the school dropouts are very high among children with disabilities. That is why we see there are 12% of children, those who have attended schools earlier, but at present they are no longer going to school. Then 27% children are those who never attended educational institution. They have never gone to school. So that is how we can see that the problems that they have. That is why they may not be able to go to school and continue their education. If we see the distribution of disabled persons in percentage by work status in India as per census 2011, if we see the total percentage of people, so if we make it as per gender wise, we see 53% males are those who don't have any work, and 47% of males, those who have disability, are able to work. Then if we compare it with the females, so 77% females, those who have developed different types of disabilities, they are not able to go to the work, while only 23% of females, those who have disabilities, they are able to work. Now if we compare it with rural and urban areas, so you can see that in rural areas 62%, considering both the genders, 62% are those who don't have any work. The work status of those 62% percentage are those that they are not able to go to work. Only 38% people with disabilities in rural areas are able to work. If we talk about the state of Meghalaya, so the age group of persons with disabilities, if we see the total number of persons with disabilities in Meghalaya as per census 2011 is 44,317. So on the one side we have age group, on the other side we have total persons with disabilities in the state of Meghalaya. If we see 10 to 19 age group, those who belong to 10 to 19 age group, the maximum number of persons with disabilities belong to this age group, that is 9,624. And if we compare males and females in the state of Meghalaya, so we could see that there are 23,326 males and there are 20,991 females, those who live with disability. So here also we can understand that males, those who belong to the Meghalaya, males, the percentage of males is higher than females, those who have developed different types of disabilities. Thank you very much.